Yes, ma'am, we are live.
Good evening, doctors, and thank you very much for joining today's webinar. It's a mixed bag webinar, and I'm very happy to introduce Dr. Ritu Santwani. Ma'am is organizer of this mixed bag webinar series. Actually, ma'am needs no introduction. Ma'am is founder and CEO of 360-degree Healthcare Studio. She is an infertility specialist and co-founder of ma'am and also board member of SWWC. We have a chairperson, Dr. Radhika Ranturi. Ma'am is a consultant at JR Hospital, Dehradun, Honorary Secretary, Dehradun OBGYN Society. Her special interests are high-risk ox and infertility. Ma'am was previously working in Government Medical College, Doon Government Medical College, Dehradun, and also assistant professor in Subharti Medical College. So with this, I welcome you all, and I'll hand over this session to Dr. Ritu Santwani ma'am. So over to you, and thank you very much for joining again.
Thank you, Prachi, and thank you, Shilpa Ma, for providing the platform from the last 2 years. So hello everyone, I am here, Dr. Ritu Santwani this side. Friends, I have started this series at the time of the lockdown, and by the grace of the God, the series is still rocking. Now almost we have completing the 3 years. So only the motto of this series is only the knowledge sharing. So by the grace of God, I get all the stalwarts. Yes, it is little difficult to get all the stalwarts on the time on board, but yet somehow I'm able to manage. So really thankful to all of our faculties and all over the delegates who are joining all across the geography. A very, very warm welcome to our today's guest, today's eminent speaker, Dr. Manglavani Madam. Madam, a very, very warm welcome to you. Namaskar.
Namaste.
Madam is the synonym for the breastfeeding. If anyone wants to know anything or any doubt, so only one name comes in the mind. And Madam is from my own city, from the Pune. And for the official introduction, I will hand over to my dearest friend, Dr. Radhika. Dr. Radhika is an eminent gynecologist from the Dehradun, my very dear friend. Dr. Radhika, will you please do the official introduction for the Mangla Madam?
Definitely. Good evening, everyone. Namaste. Greetings to everyone who have joined the webinar. Many congratulations, Ritu ma'am, for such a successful series. And thank you so much, Manglavani ma'am. You need no introduction. You're a stalwart in your field. Ma'am is a very famous obs and gynecologist and a lactational consultant at Pune. She's the director at Hirkani Gynecology and Breastfeeding Medicine Clinic, Pune. Ma'am has been the past president for the Breastfeeding Promotion Network of India. She has been the clinical secretary for Pune Obs Gynae Society 2018 and 19, the treasurer for Maharashtra chapter ISAR. She's had the Indian Achievers Award for the Chikitsak Ratan by the Global Society for Health and Education Growth, New Delhi. Ma'am has also bagged the Young Scientist Award, the 5th World Congress on the Endometriosis in Japan, Lactational and Breastcon Conference in POGS for 7 years. She's managed it, organized it, participated in it. And she's also been the first in the Gulf region to clear the IBCLC exam in 2006. She's also received the Shirotkar Oration in Sholapur Obs and Gynae Society. She's had the Best Debutant Award in the Pune Obs Gynae Society 2010-2011. And the Dhanvantri Award. She has in numerous awards, and felicitations to her name. We congratulate you, ma'am, to be on this platform with us, and we are very eager to hear your lecture. Thank you so much.
First of all, thank you so much, Ritu ji, for inviting
Ma'am, only Ritu, I am G. Only Ritu, please, ma'am, please.
This prestigious platform. Yes, you are my friend, and I should call you Ritu only. I think that,
yes,
that
ma'am.
I will be more comfortable. And it's a really very prestigious platform. And thank you for the invitation. And thank you for the kind words yourself and also Radhika. Thank you so much. So shall
I can say we are honored to have you with us. So friends, Madam is going to share with us a very, very important topic, the challenges during breastfeeding. Madam, meanwhile, I want to tell you some names of the doctor who has joined by the YouTube. Dr. Sheikh has joined from the Dhaka. He is welcoming you. He is writing, we are eagerly waiting for this topic, and they are thanking me also. That's such a good topic we have selected. Dr. Shabana Mariam has joined from the Kuwait. She is writing, I am very eagerly waiting to hear this topic. And
Great.
she's having some questions also. So, Dr. Shabana, we will take that questions later on. Dr. Pawan Bal has joined. I'm not able to, yeah, Dr. Pawan Bal has joined from Tajikistan. Tajikistan. He's also writing big congratulations and thanks for selecting such a good topics. So now we all are eagerly waiting to hear you, ma'am. Yeah.
So I'm so glad, there is so much awareness about the breastfeeding, and it is becoming good topic, So shall I share the screen first?
Yes, madam. Yes, please.
So do you see my screen now?
Yes, ma'am. Yes, madam.
Okay, great. But it is not moving. Okay, I think.
It will move, ma'am.
Just click on the slide, ma'am, so that.
Wait. Yeah, now.
Yeah.
Okay, so let us start now the subject, that is challenges in the breastfeeding. So what I'm going to go through the little bit basic, and because unless and until we know about the basic, we won't understand the challenges and how to tackle with that. So whatever the time is permitted, we will try to finish those. So friends, why we are talking about the breastfeeding? The first 1,000 days of the baby. And what is those 1,000 days? That is 9 months in mother's tummy and after 2 years after the birth. And if we don't have the proper nutrition in those days of this newborn, it is most damaging and irreversible impact. And that is how the early child nutrition is so important. It is a one-shot lifelong benefits. The gains are forever. And there are so many benefits, but I just want to give attention to one, that it causes better brain development of the baby. The baby's IQ is higher. And of course, it gives the immunity, more emotional adoption, cognitivity, and even protection from non-communicable diseases like diabetes, blood pressure in the adulthood. I just recently came across one research, the anthropologist, and what they say, that the natural age of weaning is between 4 to 7 in the human babies, and they human breastfed babies for 6 years. So what is the recommendation now by World Health Organization? The breastfeeding till the second birthday of the baby, till the baby is 2 years old. And then we say 2 years, and the baby starts eating after 1 year. So what is the point? Why we want to continue breastfeeding? The mothers, the working mothers, they have a question. But remember, the longer you breastfeed, there are more benefits. This is the best investment one can do for their kid. Mother come across so many these problems, obstacles. My baby is premature, I have a fever, but when one must understand that the mother can cross all those challenges and she can continue the breastfeeding. If she fails, she undergoes so many emotions, and the breastfeeding rate is very, very low globally, unfortunately. So let us see what happens in the hospital. So we start with the initiation first. When do you think we should start the breastfeeding? After the baby is born, because many times we say, oh, let the mother is tired, let her take the rest. After cesarean, it is not possible. There are so many myths, but the recommendation is initiation within 1 hour after birth. So there has to be skin to skin contact between mom and baby and the breastfeeding. You can see very important research from Ghana. 22% of the deaths can be prevented just by breastfeeding. And skin to skin, extremely important. Just putting the baby on the mother's abdomen and then the baby crawls toward the chest. It increases the breastfeeding rate. So what we do in the first hour is extremely important. If the mother is not able to latch the baby, then she should express the milk and give to the baby, not later. And that means it is we have to do, we have to help the mother. So what is happening normally in the hospital? The baby is kept in the warmer. Then the pediatrician will come and check the baby. Then they do the suctioning, like when we go to the dentist, how we feel that. Then they give this vitamin K injection. Some places they give bath. We weigh baby. Sometimes even the oil massage is given to the baby. Then the clothes are put and the baby is given to the relatives. So 1 hour is over in all this. So this all things can be do later. Even after cesarean. So now if you see this picture, this mother is sedated after cesarean, she's in the recovery. See, even her clothes, it is not even open. So there is no question of skin to skin. So instead, it's nicely, you can see here, the OT only, the breastfeeding has started. Even while suturing going on, the baby can be put up from the shoulder and we can start the breastfeeding within 1 hour. The next important issue is mother does not have enough milk first few days. So what to do? And that is the most common reason given and formula is given. So friends, this colostrum is in small amount, only few drops. But baby's stomach is also very small. You see the newborn only 5 to 7 ml. So even if the few drops or half ml, 1 ml, it is enough. So when the baby suckles frequently at the breast, automatically you will see the more and more colostrum comes in. And then in 72 hours, the mother gets plenty of milk. So the doctors are worried because baby may get hypoglycemia because it is small in amount. But the term babies do not get. Only if there are these high risk factors that are mentioned on the screen, like preterm baby, if the baby is hypoxic during labor or hypothermia, mother is diabetic. But otherwise, term baby does not get hypoglycemic. Baby has the glycogen storage in the liver. So as the baby suckles, that glycogen gets converted to glucose. So baby's glucose level is maintained. So we don't need to give pre-lacteal feeds like the honey or glucose water, formula, cow's milk. Lots of things are given to the baby. It replaces the colostrum and the baby may not suckle at the breast. Another is the baby's attachment. Most of the breastfeeding problems are caused by poor attachment. So it is very important. You see why I am put the picture of gorilla here. In US, in one of the zoo, when this baby was born, the zoo caretakers, they just took the baby away from the mother because they had to show to the visitors and they started feeding the baby with the bottle. And then they realized after some days, this mother is not breastfeeding. She is refusing and the baby also refusing. So the local ladies, they realized the problem. So there were breastfeeding mothers who came to the zoo, sat in front of them, in front of that gorilla and started breastfeeding their babies. Looking at that gorilla actually took the baby and put to the breast and then the breastfeeding started. So it is very important that the mothers, in the community, from the childhood, that sanskar has to be there. So in the family or even during pregnancy, if there are antenatal classes with the postnatal mothers, if they see somebody breastfeeding, they will, be more successful in feeding their baby. The position, so important. If you see the left side is the right, because the baby is nicely turned towards the mother, and see how the mother is interacting with the baby. The right picture you see, the baby is just lying on the mother's lap. It is not even turned. There is no skin to skin contact. And the mother is looking somewhere else, maybe watching the serial or, arguing with somebody. So if you see the both picture, automatically you will know how the position should be, how important it is to communicate to baby. Another thing is the hand expression. Every mother should know the skill how to express the milk, because then the baby gets colostrum And it relieves also the mother's uncomfortable fullness. It softens the breast, and then it is easy for baby to latch. And of course, it protects and improves the milk supply, because remember, the more milk comes out of the breast, more milk is prepared. So this express milk, see nicely when, it is massage, and then, with the C shape, pressing the breast back and then pressing forward, causes the milk. So it is collected in the spoon and then fed to the baby. We avoid feeding the baby by the bottle because it causes nipple confusion. So supply and demand means the more milk comes out from the breast, either by successful latching or by the expressing, and frequently, that frequency is important, 8 to 10 times in 24 hours. So if proper latching doesn't happen, then we see different problems. The first is the painful nipples, the common reason for stopping the breastfeeding, just because the position of the babies and attachment is not right. So management is easy. We have to improve the latch. There are different techniques, like it is a cradle hold, cross cradle hold. I mean, whatever the mother and the baby comfortable. But it is very important, the health professional who is looking after this mother and baby diet. It could be obstetrician, it could be nurse, it could be pediatrician, or it could be lactation consultant. But if they guide properly, definitely the latch can improve. And then mother can apply that express breast milk on the nipple, the traumatized nipple. So it helps healing. It has a lot of this anti-infective properties, the mother's milk. In old days, Ritu, they used to put in the eyes if somebody has the conjunctivitis. So such a beautiful, mother's milk. And frequent washing of the nipple and areola is not needed, because again, it causes the skin more dry. So whatever the once during the bath time, the hygiene is done. After that, mother doesn't have to wash the breast every time before or after breastfeeding. And last thing is, baby should not be taken abruptly from the breast. That can cause the trauma. Then engorgement is the next problem. Again, why? Because either the baby is given top feed and then the breastfeeding is skipped and mother has not expressed, obviously then there is going to be engorgement. And with the engorgement, then the nipple becomes flattish. And even sometimes the milk flow stops and it aggravates the problem. The important thing is, if we don't resolve this engorgement in 48 hours, within 48 hours, then the alveolar cells, they burst because they distend so much, and they die. And then her milk supply goes down. So as soon as we see her breasts are getting fuller and she's going to engorgement, we have to help her to get that engorgement relieved. We have to help for the latching, or we have to express the milk. Another thing is the cabbage leaves. It is science says, and there is something in the cabbage leaf, some chemical. So if the cabbage leaf bought from the market, washed in the freeze, and the whole leaves she keeps on the breast, you can see it. So like that for 20 minutes, 3 to 4 times a day, in 24 to 48 hours, the engorgement relieves. Or there are nice hospital graded electric pumps, not the manual small pumps. They are no use. So, but she has to express frequently, breastfeed frequently, and then she can just massage also, but by herself or by the trained person, not somebody who is not trained. Otherwise, they do a lot of the wrong things. It causes breast tissue trauma, which ultimately ends with mastitis or even abscess. So massage, actually, the mothers have a very bad memories about the massage because it's very painful if it is not done properly. So we should not give oxytocin or bromocriptine to suppress the milk, but the pain management is important. And we should not give routine galactogogues to every mother. Inverted nipple, again, it should not be a problem for the breastfeeding because the baby not latches only on the nipple. It is not nipple feeding. We call it breastfeeding, means the areola also baby's in mouth. And the teeth that is formed in baby's mouth, the 2/3 is areola and 1/3 is nipple. So if the latch is correct, then with flattish nipple or inverted nipple also baby can latch. But important thing, during pregnancy, we should not screen for flat or inverted nipples, and we should not ask her to draw or massage the nipples, to get the nipples out, because they get anxious, their confidence level goes down, and this exercise called Hoffman's exercise, it's no use. And we should not use even the syringes to put the nipple. It's very, very painful and it can damage the nipples. So again, the proper positioning and breastfeeding early. So you can see here, it is a quite inverted and flattish, and little bit the breasts are also large and pendulous. But when we help, the baby latches. So see, amazing. This mother, she came to my clinic and in 48 hours, she felt much better. And slowly with the baby sucking, actually it does come out. So it should not be problem. We can use occasionally nipple shield or the nipple puller, but it is not a permanent solution. A mastitis, again, there are different reasons, but again, the breast trauma or engorgement, all those things, the massage, the tight clothes, the mother did not get rest, all those can, end up with the mastitis. And mother can continue the breastfeeding. The treatment, again, antibiotics. It is a penicillinase resistant penicillins such as flucloxacillin, amoxicillin clavulanate, combination, cephalosporins, erythromycin, clindamycin. And we should not give the ciprofloxacin, chloramphenicol, tetracyclines, because it gives adverse effects to baby. Suppose this mastitis turns into abscess, then what happens? The sonography says that it is the abscess. The traditional thing, what? Immediately we refer the patient to the surgeon. We obstetricians, we are afraid to treat the abscess, and the surgeon doesn't know anything about the breastfeeding. So they do the incision and drainage with the big dressing, and then it is the end of the breastfeeding. Even we give sometimes medicine. So how the lactation breastfeeding going to be successful? So we don't do this anymore. So what we do, we just do the aspiration of the breast abscess just under local anesthesia. And initially I used to do under ultrasound guidance, but with the experience now, we can do it even without ultrasound guidance. At any size of the breast abscess, we can deal by aspiration. We may have to do repeatedly 2 times, 3 times, alternate day we call patient, because it is a multi-loculated. So we may not get into one go. But then there is no admission, no dressing, and breastfeeding continues beautifully. So this is the beauty. So we have 104 cases in last 2 years, and we got 101 successfully treated. So very, very successful and very satisfying. You will think, what is this mother's photo? But every lactacon, one lactacon, we have this ramp walk for this mothers. And this mother had a breast abscess. And just 4 days before she walked on the ramp, she had a 3rd aspiration. And she felt so good. And you won't even now believe she had just had a breast abscess. So what is enough milk? Again, there is some reduction of the baby's weight, but it should not be more than 7 to 8%. And after that, baby should gain weight 35 grams per day. At least baby should pass urine 6 to 7 times after 1 week in 24 hours. And the stools also, initially baby should pass stools 3, 4, 5 times each. Sometimes some babies pass stools after each feed. If the baby has not passed stool for 24 hours in the first few weeks, it is not the good sign. That means the baby's intake is less. There is a perceived insufficient milk supply because the mother has enough milk. But because, like bottle feeding, it is seen the amount of milk. But from breast, she doesn't know whether she's producing enough milk or not. Then when the baby cries or her breasts are soft, she thinks her milk is less. And then she gives the top milk. Once the top milk gives, the baby suckling at the breast reduces, and she then really produces the less milk. So this is the vicious cycle. So it is very important. We as a health professional should check what is her parameters that we have seen about the weight, about the urine, about the stool. If we think there is a little lag in the weight gain, we can increase the milk supply. We should not immediately give the formula. That is not the solution. And most of the time it is because of the mismanagement in the early days and the weeks. So we have a solutions: frequent breastfeeding, proper latching, and galactogogues. Galactogogues are the medicine which increases the milk supply. So there is a domperidone that we are giving because it doesn't have a side effect, and we don't give the metoclopramide anymore. We used to give that before, but it has a side effects. And lot of now herbal medicines, like we use the shatavari most commonly. Then there is a fenugreek seeds. So we can just use those. There's something called induction of the lactation. The mother who is not pregnant, she can breastfeed. Just looking at the shape of this mother, she's a nulliparous. So when we induce, she got this 30 ml just before the baby arrived. So if she's getting the baby by surrogacy or adoption, we should refer the case in a center where it is being done. And I think the mother feels very satisfied. Now, because our clinic is a referral center, we get a lot of cases for induction. Again, when the mother is discharged, the hospital should prepare her where to go if she has the problem. So we should have at least mother support group, mother to support group, lactation clinics. There are a lot of internet forums, but having the breastfeeding clinic is very, very important, so that the mother can go if she has any problems. Come in the community, anywhere mother goes, it should be baby friendly. It should be breastfeeding friendly. Mother should able to sit in the restaurant or even on the beach, and breastfeed. And that breastfeeding in public is so important for, for all other ladies, all the community. Then they will automatically think breastfeeding is normal. Even you can see the picture on the left side, the teacher is breastfeeding and the children are watching. So it is a good sanskar for these children. They know this is how the baby is fed, Now, I recently went to UK, and one of the building we went, the company, and in one room outside, this was the board. Effective immediately, room 306 is no longer designated smoking room. We are pleased to announce that room 306 is now designated as official breastfeeding room. Wow, such a positivity there, So this is how even this year's breastfeeding week, the theme is enabling breastfeeding for the working parents. So even the mother is working, she should have enough facilities at work where she can express the milk, she can store, and she can take that milk in the cold storage at home. And the next day, the caretakers can feed. Another one is baby friendly hospital initiative. So there are 10 steps to launch, and we have discussed few steps. The important thing is antenatal classes. We should sensitize the mother. We should take separate class for 1 to 2 hours and give her all the information. Now for Breastfeeding Promotion Network of India, Maharashtra, that is BPNI Maharashtra, we help for the hospitals to get the BFHS certification. So if any one of you want, you can just email me or ask Ritu madam, and we will guide you properly. Even do you know there is an examination, master's degree in breastfeeding called IBCLC, and we conduct this training regularly. Another just 2 minutes, I want to talk about this IMS Act. That is Infant Milk Substitute Act. So it protects the breastfeeding by controlling the marketing and promotional activities of the baby food manufacturers. And what it prohibits, that any advertising, it prohibits promotion direct to the public by advertisement, not giving free samples, And then even the health facility, there should not be display about those formulas, and we should not get any gifts. We should not take any gifts from them. Even, we should not eat the food by this any CME organized by them. We should not attend their any of the CMEs. So very, very important, formula giving in the hospital will reduce the breastfeeding rate. So very important. There are a lot of barriers in the health professionals, but we can cross all those barriers by our proper education and proper helping the mothers. So correct positioning is the key thing for the proper successful breastfeeding. So alone we can do so little, together we can do so much, because mother cannot just sit in the room alone and breastfeed. We have to support her. Thank you, friends.
Thank you, madam, for such a wonderful lecture. Madam, there are some queries which which I received earlier only. Madam, will you please stop sharing the screen? Yeah. So meanwhile, Alka madam has joined. Welcome, Alka madam. Only 2-3 questions I will take. Madam, there is one question from Dr. Shabana only. She has joined from Tajikistan. What is your recommendation in the cases of the breast abscess and breastfeeding? Lot of confusion for that. So now you are the stalwart. You can only guide for this.
First thing, there is no harm at all to feeding the baby. Mother can at least there is a unilateral usually abscess. So other normal side she can breastfeed. Even the other side, if the abscess is very near to the areola and nipple, and sometimes they can see little pus coming out of the nipple. In that case, maybe for a couple of days they should not feed the baby from that side. But science does not say don't feed. It is still okay. But expressing the milk is very important to maintain the milk supply. And that expressing probably with the breast pump is better, because breast is all inflamed. And then we do this aspiration every alternate day. Within the week she gets better, and then she's continuing the breastfeeding. So the breastfeeding goes beautifully, and it is such a painless procedure, the aspiration, because under local we just put the needle and aspirate the abscess. But if we do the incision drainage, then is the big problem. Most of the time, then breastfeeding ends. We should not give medicine to stop the breastfeeding, such cases.
Thank you, madam. Madam, there is one request from Dr. Rupali Jain. She is here only in the Zoom platform. She wants to know regarding the antibiotics for the treatment of the breast abscess.
Yeah, that is what I showed some.
She wants again to be highlighted for that.
So we can give the cephalosporin, or we can give the cloxacillin is good actually, I feel. Or then we can give the clindamycin. We should not give the tetracyclines, and amox and clavulanic acid combination is also good. But the important thing is antibiotics we have to give for 10 to 14 days, not just 3 days and 5 days. Even I have given sometimes for 20, 25 days the antibiotics. So they need longer the antibiotics. So as soon as we remove the pus aspiration, we send it for culture sensitivity. And depending on that, then if needed, we change the antibiotics. But we don't need admission for the breast abscess or mastitis in the hospital. No admission.
Yeah.
Any big abscess.
Yeah, correct. Yeah. Thank you, madam. Madam, there is one more question that is from Dr. Jainab Sheikh. It joined from the Dhaka. Madam is writing. What is not there? Madam is writing. Can you please enlighten something about the milk banks?
Yes.
I think that for that I have to invite the madam for the separate lecture, because there is a lot of things to discuss. Ma'am, anyhow, you can tell us in the brief. Yeah.
I'll just tell the milk bank is what? Like our money banks, so we have to keep the milk there. So the mothers who has the copious milk supply, they donate the milk. and then we can keep the milk in the milk bank. So there is, all the process, the pasteurization, then freezing and everything. And it is because it is limited milk. So mainly our priorities we give to the preterm babies, and after because it is so beneficial, the milk for all the babies. So twins or preterm babies or the sick babies, and if there is enough, then even some term babies. Because nowadays the breastfeeding rates are so low, less than half of babies are only successfully breastfed. So there are more and more milk banks coming. And I think now in Pune we have 7 milk banks, so we are very fortunate enough. But each maternity hospital, which is a busy maternity hospital, I think they should have their own milk bank.
Thank you. Thank you. Thank you. Thank you so much, madam. Actually, a lot of things has to be asked. I think we will keep one more session with you as per your time permits. And
Yeah, we
thank
can
you.
give only questions and answers next time.
Yeah. Sure, ma'am. Yeah.
Thank you so much.
Thank you once again, ma'am, for the bottom of my heart for enlightening all of us. Yeah. So now we can welcome. Yeah, I think Alka madam has joined. Yeah, Alka madam, very warm welcome to you. Alka madam, are you there? Alka madam?
I'm there. Yes, I'm there.
Yeah. A very warm welcome to you, madam. Dr. Radhika, please do the introduction of the madam, then I will welcome her.
Namaste, Alka ma'am. Welcome to the webinar. Ma'am is another stalwart, Dr. Alka Guthe ma'am. She's the consultant Obs and Gynae, President Amravati Obs and Gynae Society for 2008-2009. Ma'am has many accolades on her CV. She's been the LLM for the Criminology and PG Diploma in the Human Rights. She's the chairman for the IMAMS Medical Legal Cell 2023. She's also been a part of the National Coordinator, Foxy Ethics and Medical Legal Committee 2020 to 2023. She has the IMA Mission Pink Health Regional Coordinator 2016 to 17. Past President, Indian Medical Legal and Ethics Association, past President, BPNI, Maharashtra State 2006 to 2008. Central Coordination Committee member from the BPNI Delhi, founder member and National Secretary, Human Milk Banking Association of India. Ma'am is also the regional trainer, the first Golden Minute Project, National Adolescent Health Trainer certified by Foxy, Government of India, WHO. She's also a master trainer for Foxy Dhira, Violence Against Women, regional trainer for the Foxy IAP Perinatal Meet, the Read Best Committee and the Chairman Award Medical Legal Committee, AMOX 2020, received the IMA Star Award for Academic Excellence in 2022-2023, author of the book Child Labor, Amcha Kai Aprad, participated in the relay song that made entry in the Guinness Book of World Record. Congratulations, ma'am. It's a terrific CV and we are waiting to hear your lecture, please.
Thank you so much.
Please stop sharing. Yeah. A very warm welcome, my dear friend, Dr. Alka madam. I'm really thankful to Alka madam. I know madam schedule is very busy. Madam, from our side, a very best wishes for your election. I know this is from today the voting is started and madam is very busy, though madam has accepted the invitation. So today madam is going to discuss with us a very important topic. I think everybody has some thing for this related, that once you receive legal notice, what to do, what not to do. So today first we will hear from the Alka madams and then we can take some questions. Madam, over to you.
Thank you, Ritu, for inviting me. Though it's a busy schedule for me, as you know, Foxy election started today only. But I said the topic is very important when I'm going to chair, want to chair the committee, Ethics and Medical Committee. It's my duty first to educate my members, rather strengthen their inner skill, inner courage, so that they can, if at all they receive the legal notice, what they should do. So the topic given to me is legal notice, what next? I will share my presentation.
Yes, ma'am.
So once again, thank you very much for inviting me, Dr. Ritu. The topic today given to me is received legal notice, what next? So I bring greetings from our own society, Amravati OBGY Society, for all of you. Friends, you know, Consumer Protection Act and doctors, what is the relation between the two? It was passed in 1986, long back, got implemented in 1990 due to the Supreme Court judgment, VP Shanta versus, it was like IMA versus VP Shanta. And it got amended recently. You know, we are within the ambit of IMS Act, unless there is some new case that will appeal this amended act. This is a social legislation. It means the act seeks interest of the consumer. So the main intention or main purpose behind the enactment is consumer's interest. But at the same time, if we protect ourselves by the rules and regulations, then we can, of course, protect ourselves in the court of law if at all we receive legal notice. Now look at the beautiful scene. This is the Bombay's beautiful place of Queen's Necklace area. All of you know this particular street. How beautiful it looks. But look at the other end. What has happened? This is the scene of burnt ambulance. Again, the indoor nursing home ward, everything is destroyed. This is a famous case. It's a tertiary care center, Singhania Hospital. It was burned to ashes and more than 15 crores lost within just 15 minutes. This was the scene after the death of one of the political leaders in that hospital. So, what is our aim? What is the aim of our Foxy Medical Legal Cell or any medical legal association? We know that it is very difficult to adjust, rather make the amendment in the law because it takes many years. But our intention is, our aim is not to have injustice to any of our members. We know very well that we cannot change the direction of the wind, but definitely we can, and successfully we can adjust the cells. So we must know the law that governs our day-to-day practice, and we must know what things to be done if at all we receive legal notice. Panchatantra has very nice line. I would like to quote this line. A small slip can make big trouble. So an ounce of prevention is worth more than a ton of cure. So we must give stress on prevention rather than fighting the case in the court of law. There are many tricks we will learn in the course of time, how we can prevent the litigation and what to do if we receive legal notice. So what is our power? Our power lies in our small daily choices. What principle we should follow, what guidelines we should follow to create happiness in our obstetric practice. We should have sound sleep and litigation practice. Look at the beautiful song. Look at the how all the boards are gathered together. But that is the strength that it shows. But at the other place, you can see the picture of people enjoying the storm without being aware that the next day it can damage to their city, their property. So we must remain united together. If at all there is fight, if at all there is a litigation against us. So there is a course of role of our has chosen our specialty. But because of that, we are always sandwiched. Where in the provisions of CP, that is Consumer Protection Act, and the guidelines of reach no point of no return, just like the delivery of the breach. In the case of breach.
Only a second, ma'am. Sahiti, please mute everyone except madam. Please mute everyone. There's a lot of disturbances coming. Sahiti. Dr. Apurva, please mute yourself. Yeah, madam, you can continue. Welcome, ma'am. Sorry to disturb you.
Okay, thanks.
Yeah.
So we are a sandwich rather between the provisions or guidelines of the CPA or the provisions of CPA and guidelines of the association. And we are reached in no point of no return, just like the delivery of the after coming head in case of breach delivery. So if at all we want to survive in this era of consumerism, Consumer Protection Act, we must know rules and regulations. Look at the scene. There are hatte scene hai. It's a horror movie scene. The chickens, they are enjoying, the other getting grilled, without knowing that tomorrow it can be their turn. So we must never say, "Arey, हमारे पड़ोस में एक डॉक्टर के अगेंस्ट लिटिगेशन है, मुझे क्या करना है?" tomorrow it can be your turn. So always take precaution. Don't be just bystander. Help the doctor. The question comes to our mind, should a doctor yield to demand of asking money for alleged negligence? I know the gathering will say no, because it will just postpone the problem. Patients are more likely to take us through the legal process once they get the money. So they will ask money from you, and again they can resort to litigations. And there can be like hunger. They will go on asking money, and again the litigation will be there. You can't stop them. So we have to fight. How? Whether we should fight with money, never compromise. You can go for out of the court settlement, but that's in a legal way, not unofficially. We should go with sword, don't at all, don't give threats. Not with gundas, still we belong to noble profession. So don't take help of the so-called social workers. There are many good social workers, but there are some extremes of rather nature of the social workers. So we must defend ourselves with right. It is a right to defend ourselves. But of course, using pain and brain, not with might, not with threat. What we must do? First and foremost thing, when we receive legal notice, always contact our insurance company. We must have good insurance cover that can pay the damages if at all the case goes against. So there are many insurance companies or service companies. They have legal liabilities to pay damages for the negligence. We should be alert. Means we should involve them whenever we suspect that there can be case against us. They are the protector for financial losses. Whether they can give full financial relief or mental relief, that's a question, big question rather. We must have good professional indemnity, hospital insurance policy, and risk management policy to safeguard us if at all we lose the battle. Again, the next question, should one receive a legal notice? That is very important question. Yes, we must always receive a legal notice because it gives us an opportunity to answer. If we don't receive legal notice, how can we answer? Again, it makes us focus on planning future defense. If we don't read the legal notice, how can we plan our future defense? So we must always receive the legal notice. So in short, receive the summons, never refuse. It will enable court to pass ex parte order of negligence and compensation against you if you don't receive the summons. Again, it will give wrong message to public, press and media. The doctors themselves, they are not law abiding. They are not receiving legal notice. There can be spiraling of premiums of professional indemnity insurance. These are the negative effects of you are not accepting the legal notice. Again, the medical professionals will start resorting to defensive practice. This is bad effect. We must never start defensive practice, but we must protect ourselves by knowing rules and regulations that govern our practice and how to answer the legal notice if at all we receive. We can receive legal notice from consumer. It can be addressed to person concerned. He or she can be head of nursing home or unit in charge. It can be addressed to the name of nursing home. Other name may or may not be there, even though they were a part of treating team. Suppose you have a team of anesthesiologists, gynecologists, pediatricians, intensive caretaker, all this belong to team. But you may receive letter. So it can be addressed to you, but you have to receive the legal notice. You may receive it by ordinary post, by under certificate of posting, by registered post, by speed post, by courier. So there can be any means by which you can receive legal notice. There are certain guidelines for receiving legal notice. Don't ignore legal notice. Study it properly page by page. Each and every word of notice is very important. Study the case once again. Go through the case in details. Find out different options of management. Prepare a draft reply in consultation with your friend, colleague, any senior or junior colleague, competent colleague, or association that then show it to a lawyer. After correction, after showing it to lawyer, prepare a final reply. Always remember, your first reply should be the final reply. It is like a foundation of a building. If foundation is weak, building will collapse. If foundation is strong, the defense will be strong. You cannot and should not change your basic stance. So preparing basic reply is very important. You can take help of the medical legal consultant. Why reply legal notice in consultation with medical legal consultant? Because lawyers they have legal knowledge. They cannot give required flavor. That treatment given was diligent, prudently, with due care and precaution. Because they have knowledge of only law. They don't know complications of medicine. there are certain inherent complications while treating the patient, but they don't have this knowledge. They have only legal knowledge. So what we should do next, or next step is, there can be certain mistakes we should try to avoid when we defend ourselves in the court of law. Again, the question to you, post notice, many times it is asked by your lawyer, wait and watch. This is the usual advice given by lawyers in post notice period. Wait till next legal move of the patient. But we should never do this. We should start gathering our vital evidence, because it gives us time to gather vital evidence. So we should never wait till next legal move of the patient. We should start collecting, gathering our vital evidence. Should one be proactive in preparing the defense? Of course, it is said that a forearmed doctor is forearmed in gathering medical evidence, because this is the medical evidence that can protect us in the court of law, that will show that our treatment was as per the prudent guidelines of the association or the act. Evidence collection, is time consuming. So the beautiful picture I would like to show, always I have put this picture. Don't wait for the disaster. We had gone to one conference in South area, Chennai. I promised it was Chennai conference. The next day, we came back. Next day, there was news in the paper. There was a storm at Chennai. So the similar thing, the people are enjoying because they got the aquatic animal. But the aquatic animal was sharp enough to come on the surface, but the people were not aware about the next day. So always be prepared for the disaster. It may go against you if you are calm and waiting for the patient's move. Who should defend your case? Whether you can defend your case or lawyer? The answer is very simple. In consumer court, we can fight our own case, of course, with the help of lawyer. Even in medical councils, we can fight our case with the help of medical legal consultant. Many times we just make a mistake by handing over everything to lawyer, and we just watch as an observer. In this very famous case, a busy obstetrician handed over everything to expert documents. The patient was of excessive vaginal discharge following abdominal hysterectomy. The smart consumer put it in such a way that as if she has vaginal fistula following abdominal hysterectomy. The busy obstetrician thought his lawyer was expert. Nothing of that sort actually had happened. So why to bother and why to worry? What was the result of the case? The case was lost at district forum, and obstetrician had to pay huge amount, substantial amount, before going for an appeal, because he was just observer. So he should have explained nicely what is meant by leukorrhea, what is meant by vaginal discharge. It was not at all a complication of the operation. What mistake one can do in while selection of a lawyer? Just like medicine, we have specialty, super specialty, and subspecialty. Lawyers also have their specializations. So always select expert lawyer belonging to that particular court in which the case is filed. So he can be civil lawyer, criminal lawyer, MMC lawyer, consumer lawyer, depending upon the case or depending upon the forum where the case is filed against you. In this particular case, a 68-year-old member retired within the next 2 years issued a well-drafted legal notice from Ludhiana demanding damages of 70 lakhs for a stillbirth that had taken his hospital just 6 months back. After a lot of deliberations, a reply was given to that patient, the complainant. The concerned family was mostly satisfied by the reply, and therefore a complaint was not filed in National Commission. So look what can happen if you properly give the reply with the help of medical legal consultant. While in another case, similar case, 72-year-old consultant, when he received a legal notice from patient husband asking rupees 18 lakhs as damages, doctor replied and advised patient husband, pray to the Almighty God 4 times a day at home, give holy water 3 times a day, go to worshipping God, God's place twice a day, visit once a month such a holy place to worship your God, so that you will be free of litigation or that case. Friends, this reply was read out at the time of hearing by complainant's lawyer in the court. Everything was funny. So the judge said, you have lost the case. President passed strictures while delivering judgment. We should always avoid such mistakes. They have got no standing in the court of law. It can cost lakhs and lakhs. By defending your case, you may lose the case. So well begun is half done. If you have proper insurance policy, you have selected proper lawyer and replied properly after proper homework and answer the legal notice in time, you have won half the battle. Now wait till you receive the complaint that is plain from consumer forum. In the meantime, collect all the references till you receive plaint, that is a reply from the complaint, or the complaint from the consumer forum. Collect all case papers, all the evidences you can collect. Plaint is the reply, that the plaint is a complaint given to you, addressed to the court regarding complaint about the doctor. You have to check all the pages, all the annexures, check the name, date, and year on the various reports. You should see that it should belong to the same consumer. In one particular case, the plaint was without any annexure. In another case, urine report was attached. It was 3 years old. It was belonging to some other patient. In one more case, registered letter contained plain papers only instead of plain. Only the top and the lower last paper was about the patient, but without the pages in between were blank papers. In another plaint, Xerox of the discharge card was enclosed, but actually only the first page of Xerox was attached, not the second and third page was attached. So all these mistakes, these are the tricks of trade. Always be careful and vigilant. Do not make mistake of ignoring these silly things from the patient's side. Point out all these mistakes to your lawyer first, and immediately bring it to the notice of opposite lawyer and of course the court and the forum. One has to be careful at each and every step, because you know the famous dictum, ignorance of the law is no excuse. We must know all these things while defending our case in the court of law. Again, written statement is the reply given to the plaint, given to the complaint. Written statement depends upon the documents of the case. Referral notes, investigation, post anesthesia notes, everything. Please ask somebody to mute audience.
Sahiti, please mute everyone. Dr. Pratibha, please mute yourself. Dr. Pratibha. Sahiti. Yeah. Sorry for that, ma'am. I don't know how come they are able to unmute themselves.
I think the platform should take care. Platform person should take care. Okay. So indoor case paper should be like general hospital, teaching hospital case paper. So you should watch how the general hospital or teaching hospital case papers are. We should make our case papers according to the generally government hospitals have format. How to prepare the case paper, how to prepare the file of the patient. Indoor case paper has certain like guidelines. It is like university examination answer book. We write the answer book meticulously, correctly, because we should get more marks. Similarly, we should write down the indoor case paper. Do not write on the first page and back side of the first page. Start your clinical notes from second page, because this page is reserved for important landmark notes, rather important investigations, important notes about the critical condition of the patient, allergy to certain drug, etc. So don't write on the first page and back of the first page. Start writing from the second page. Do not change format of writing as far as possible. Do not change ink or pen as far as possible. Do not scratch or overwrite. If at all you want to cancel the statement or the sentence, you can scratch it fully. Don't overwrite. Even if it is visible, if you can scratch it simply by a single line, even if the court or the lawyer sees, he can say that it is scratched completely, but don't overwrite. It will be suspicious. Write date and time every time. After each and every clinical note and treatment, one must sign, even in our own nursing home. What happens? Whenever we visit another hospital, we sign the papers. But when it is our own hospital, we never sign. But we must sign our hospital indoor case paper, everything related to our hospital as well. If our subordinate or junior resident is writing notes for us, we must sign only after reading the notes. We are owner of our nursing home or our unit. It is our responsibility for all the acts of omission, acts of commission by anyone, our junior. This is called as vicarious liability. So always sign after properly reading. Otherwise, you will be liable for mistakes done by your juniors. Do not write short form like injection MP, injection Gara, injection Canna, injection Janta. It is difficult to convince non-medicos like judges that MP means ampicillin, Gara means garamycin, Janta means gentamicin. If American says Thanda matlab, we immediately answer Thanda matlab Coca-Cola. But the answer will not be there in case of litigation in the court of law, because the judge never understands MP means ampicillin. Please use the same trade name of a drug that is available in your nursing home and see to it that the same name is written in nurse's order book and on case paper by nurses. Because if you advise certain drug, and if it is not written on the case paper or the nurses medicine record, the court will think that there is some you have managed certain things. So always write the drug or injection which is available in your nursing home or which you have prescribed, and same injection, same medicine should be written by the nurse. It is said that good practice promotes good recording, while shoddy records suggest shoddy care. And no records, no care. So always record must be in legible handwriting in chronological order with date and time every time, signed by you. Medical records are our legal documents. They protect us in the court of law. I will just quote few cases. This was a case, anesthesia was given at 10 a.m. by two anesthetists. Child became pulseless at 10:30 a.m., means after half an hour. There were two progress cards of the same child on two separate papers. Why two anesthetists? Reason was not mentioned. Name of the anesthetist not mentioned in OT notes also. Hospital was held accountable. Negligence was proved because everything was deficient in case record. So documentation should be perfect. Indoor case record for indoor nursing home. In this case, injection metoclopramide was advised. Doctor on phone advised injection perinom for post-operative vomiting to two real brothers of 12 and 10 years respectively, operated on the same day. Since injection perinom was not available at that time, nurse gave some injection. After the injection, both brothers became serious. They went into respiratory arrest and ultimately died next day. There was a criminal complaint against doctor. Police sub-inspector, while investigating, found out that injection perinom was advised, injection regulars was charted on the paper, and father of the children produced a chemist's bill of the same day and same time of injection Pavlon. You can understand what must have happened to the child by giving injection Pavlon, or there was some cheating by the patient's relative, but nothing was properly mentioned. There are two different names on two different case papers. So what was the result? Both doctors and nurse were put behind the bar for 48 hours under 304, not 304A, which is bailable offense. 304, difficult to get bail, though bail is given, but lot of efforts by the doctor to be made to get the bail. So don't make mistakes or defense become very poor in such silly mistakes. In this case, 48-year-old paramedico's mother was seen on 10th and 17th April in consulting room. Investigations were done, CBC, urine, blood group, and RH diagnosis. The diagnosis was bulky uterus. Patient was admitted on 18th April morning for hysterectomy at 1 p.m. same day. Patient went into cardiac arrest during operation. The patient was revived, transferred to another hospital for ventilatory support. Died in that hospital on next day. OPD papers were not attached to indoor paper. No pre-operative notes. History investigations were not written on indoor paper. After 3 years, case came up for hearing. There was no documentary evidence for defense. There was no alternative but to do out-of-court settlement. The doctor had to pay huge amount just because documents were deficient. A 48-year-old obese patient, while doing abdominal hysterectomy, left ureter was damaged. Neurosurgeon was called for help. Operation lasted for 7 hours. On case paper, no operative notes, no mention of intraoperative complications for first 7 days. Patient's note, you can see how the patient's note were written. Date was written, but no time. GC fair, TPR normal. We should leave this practice of TPR normal. We should always write temperature, pulse, respiration, and write down pulse, respiration. Treatment given on first day was written. Afterwards, there was no, everything was CT all. No signature of doctor, there was no signature of nurses in that order book. And again, the nurses were unqualified. There are certain insurance companies that cover unqualified nurse as well. We have to write down on that particular insurance company, whatever coverage is given. But in this case, nothing was written, no signature of doctor also. On 8th post-operative day, patient became breathless and the patient developed, there was a question mark with like differential diagnosis, deep vein thrombosis. Patient was transferred to another hospital for tertiary care. Patient's husband had taken out xerox of each and every page every day. So what must have happened? The patient must have taken either snatched away from the staff or the staff must have given the paper out of good faith. Please note, after intraoperative complication also, there were no notes in regarding the intraoperative complication. So what was the result? The case was lost in the court of law. This was a serious, gross mistake. There was no defense at all. So always avoid such mistakes. In one case, single-term pregnancy, the baby got delivered vaginally. The patient went into PPH, died within next 3 hours. Delivery notes were written in the following manner. Consultant wrote, baby female was born at 8:20 a.m. on 13 February, weight 2.8 kg. Nurse wrote in her case notes as timing of delivery 7:30 a.m. on same date. Municipal Corporation record mentioned timing of delivery at 8:45 a.m. on the same date. How one child can take birth at 3 different times? It's very questionable defense, no? So our all arguments become poor in such case. And when the PPH patient delivered a single baby at 3 different times, so it was all the manipulated case. So these mistakes will be pointed out by judges, by lawyers. It will create problem while defending ourselves. So always be careful, keep cool while writing down the notes, be calm and think twice while writing down the notes while preparing defense. We can take help of the medical consultant, senior colleague, or even competent colleague, then only complete the paper and avoid such mistakes. In one particular case, there was an operative case, again, case of operative laparoscopy while doing surgery, there was anterior-abdominal wall hematoma. There was damage to a bigger vessel and created huge abdominal hematoma, anterior-abdominal wall hematoma. General surgeon was called for help. He opened the hematoma and there was profuse bleeding. See the notes, surgeon's notes, gynecologist notes, and anesthesiologist notes. Regarding pulse, BP, pallor, you can watch the discrepancies in the notes. For such a patient of huge abdominal hematoma with profuse bleeding, the gynecologist had reserved only 1 pint of blood. And patient died even before 1 unit of blood was transfused or brought to the hospital. So friends, don't use adjectives while writing clinical notes. Always write the amount of blood. Approximately this much amount of blood was lost. Please see what other specialists are writing for the same patient. There should be coordination between the notes, no discrepancies. Don't give false hopes to the patient's relative. State what is the actual condition of the patient. All is well. We should give this practice of saying all is well. You should state actual condition of the patient. That will help us in defense. So always avoid such mistakes. Mob violence is important. It requires separate lecture for mob violence. So I will just skip this slide. Great risk of mob going out of control and behaving aggressively to hurt you or your property. So if at all you want to declare some mishap, declare the mishap slowly, taking the help of your colleague also, and in your consultation cabin, because you are the master, you are the powerful person in your consultation cabin. Don't answer their queries in veranda or corridor. Always call patient's relative in your cabin. You can take help of the senior or any competent person because you are exhausted by the treatment. While giving the treatment, you can take help of any competent colleague. Responding to media, you can think twice before responding. Because if at all you want to give an interview, sometimes what happens, certain sentences can go against you. Remember one thing, that public memory is short. They just forget whatever they read today in the newspaper, tomorrow they can forget also. Always keep your profile low. Press statements can be utilized by consumer or the opposite lawyer and they can go against you. Always be calm and cool. What happens if at all you go on answering each and every step, each and every question raised by the patient's or complainant's relative or the media person? There can be percussions and repercussions. It is like throwing stone in the water. There can be again repels of the water. Again, you throw the stone in the water, there can be repels. So always stop responding to media immediately. And you can take help of the crisis management committee. If at all there is litigation or you receive legal notice also, you can take help of the members of the crisis management committee. There are different crisis management committee at district and taluka level. It consists of doctors, social workers, politicians, legal personalities, press reporters. You can make a crisis management committee in your city also. Always meet police officer, request for investigations. Police may refer the case to a panel of experts before lodging the FIR, before accepting the FIR. Always avoid press publicity or interview. Till the guilt is proved, always avoid the interview because they can go against you. So there can be prosecution, but still keep your profile low and don't try to answer each and every question publicly because certain things you should keep for your defense. So they will be answered by your lawyer. Again, there are very important lines in Foxy. Dr. Sanjay, Prakash Pawar, Dr. Sanjay Gupta sir, Dr. Walke, Dr. MC Patel sir. There are many medical sales of Foxy IEP, IMLIA, IMA, or parent body, IMLIA also, they can help us in the crisis. Whenever there are cases against us, these are the medical legal helplines. We can take help of these medical legal helplines. So to take out insurance for proper insurance policy, proper insurance coverage, and renew it every year without a single day gap. Select a sincere lawyer who is interested in your case and practices in that particular forum or court. Do not ignore notice. Check the plan properly page by page. Pay attention to your documents at each and every stage of patient's care, not only when patient becomes serious, but that the case is filed against you, but that should be your habit in your day-to-day practice. Don't give press or any cable TV interview. Do not respond to press news immediately. District level crisis management committee can help you in your medical crisis. Friends, I would like to call 3 golden rules. These are the rules written by a great son of India, Vivekananda Swami Vivekananda. Don't forget the people who help you. Don't hate the people who love you, and don't cheat the people who trust you. Patients come to us with trust, with lot of expectation. So try to give prudent care. You can't give guarantee of cure, but you can give guarantee of care. So always give prudent care. So thank you, Ritu. Thank you, dear friends who have logged in for today's wonderful webinar. Thank you very much for inviting me to speak on very important issue for which many of us are afraid of when we receive legal notice. Thank you very much, Dr. Ritu.
Thank you, madam. Thank you so much. You have cleared so many doubts. So, madam, of course, this is a very, very important topic, and lot of us is having a query related on this. Madam, with your permission, I know it's already 10. So I want to take only 2 questions. Madam, this is one question is from Dr. Yamuna V. She has joined from Punjab, Ludhiana. She is writing she's also congratulated you for the good presentation, and she's writing that her question though is not related to this topic, but as you are a medical legal expert, she want to know your opinion. Ma'am, this question is very relevant. She wrote that, ma'am, these questions I'm receiving on the YouTube. So she wrote that most of the medical representatives are coming to her and asking for the sum of the other product branding. They showed her for some vaginal wash branding. So is writing, can she go ahead or not? What are the legal implications for that?
Yeah, very nice question, because it's asked many times during conferences. So we all know that branded product and generic product. So these are the guidelines we have received from our MCI, rather that controls our practice. So as per the guidelines, we should advise generic names, generic medicines. Write down injection ampicillin, and if at all you want to prescribe certain brand, you can write particular brand, but generic medicine you have to practice. Because what happens, as per the guidelines, we should never, there can be conflict of interest, because the company can sponsor your travel, the company can sponsor webinars or anything. So we should never prescribe branded name, because it is as per the guidelines. So if at all they visit to your hospital, you can say hi, hello. Always write a generic name first. And if at all you are very much, you might want to prescribe the same medicine. So you can be option, but it is option. Your main prescription should be generic, not branded. Otherwise, it can go against you. If at all something happens with the patient, again, there can be like you are violating the guidelines. So though they are not rules as such, there is no law, but the guidelines also are sometimes enforceable, because it is the like our standard practice we should follow while prescribing medicines. There are certain guidelines for prescription, guidelines what we should write, what we should not write, how to write. Everything is given as per the standard format. So this guidelines always ask us write generic, not branded.
So means we are not supposed to do such kind of the videos which are showing the brand name of the medicines. So we can focus only the what is the content on that.
Yes.
I hope your point has been clear, Doctor. Madam, other question we have received from Dr. Yamuna. She has joined from Ichhal Karanji. She is writing a very, very nice lecture. Madam has cleared lot of doubts. Besides that, madam, lot of appreciations we are getting. I think no more questions, only the appreciations we are getting. So thank you, madam. Thank you so much for joining with us today and clearing our lot of our doubts. And with this, we will wind up today's session. Thank you.
With your permission, I would like to once again request. I am going to contest. Rather, I am contesting for the post of chairperson, Foxy Ethics and Medical Committee, and Radhika is there. I appeal all to please vote for me because I am working in the committee since 20 plus years, and actually I have done work with almost all the committee chairpersons, and I have law post graduation in criminal law. In the present era, most of the cases are criminal cases against doctor, and in particular medical crisis, the doctor requires help. The person should be able to answer the questions, rather solve the problem. But the doctor has to face a medical crisis. So I request all to please vote for me. I'm there always, friend, next to your call. Whenever you will call me, I'm always there to help you whenever you require my help. So thank you once again for giving me opportunity.
Thank you, thank you. Thank you so much, madam. Actually, I was going to tell that only the best wishes before winding up. And thank you. Yeah, thank you, Radhika also. And thank Mangla madam is still there. Thank you, Mangla madam. And thank you, Alka madam, for enlightening all of us. I want to thank from all our academic buddies. This is my academic buddies group who all joined from all across the geography. I can able to see Dr. Samuel has joined just now. Dr. Samuel Ajbur has joined all the way from Nigeria. So thank you to both of you. Thank you, dear Radhika also. And a big thanks to Shield Pharma for constantly providing the platform for this program. For doing any successful program, yes, we definitely need a platform. And thanks to Sahiti for making it live on the YouTube. So later on also the viewers can go through these recordings. And thanks to Dr. Prachi also. With this, we will wind up today. Yeah.
Thank you, Ritu.
A very good series that you are doing, and you are, enlightening so many doctors. It's wonderful. And I love your fresh, smiling face, which energizes everybody. But thank you.
Thank you.
Ritu's place is always glowing. She's like Santwani, calm down.
Thank you, madam. Thank you. Thank you so much. Thank you.
Thank you for your enthusiasm. You are doing since many months. I know that.
This is the third year of the program, ma'am. Earlier, I had done the Pundit. That was also very popular. Abhi now, from last 15 days, I have not done any show because of busy. So, lot of messages I received why the show is not coming, why the show is not coming. So, I thought, yes, today we must do. And thanks to all of three of you. Radhika also has joined, Alka madam and Mangla madam. Yeah, big thanks to you. Yeah.
Thank you, Ritu. Thank you, Radhika.
Thank you.
Bye-bye.